Hello everyone, welcome to our educational video on reactive balance and perturbation-based training for older adults. The purpose of this video is to demonstrate exercises specifically designed to improve balance, speed up stepping reactions, and enhance recovery from a sudden loss of balance. Before we begin, a quick safety reminder. Always clear your environment of trip hazards. Ensure a therapist or spotter is close by. Let's look at the exercises.
This exercise is tandem walk. It is designed to improve dynamic balance and reactive trunk control within a narrow base of support. Begin with standing upright with the heel of your front foot touching the toes of your back foot on the line. The patient must looking forward while walking. The therapist guides closely from the back, holding the gait belt securely to prevent any backward or lateral loss of balance. To progress the exercise, the tandem walk is performed on a soft mat. This dampens sensory feedback from the feet, heavily challenging the patient's dynamic ankle stability and balance. A secondary progression introduces unexpected gentle manual perturbations from the side. This forces the patient to use immediate reactive hip strategies to recover their posture within a narrow base of support. This is the sudden obstacle avoidance exercise. It targets gait adaptability and rapid stepping strategies by forcing the patient to react to unexpected environmental changes. The therapist guides closely from the back. As the patient walks, the therapist introduces a sudden obstacle. The patient must immediately alter their swinging limb trajectory without looking down, training reactive postural control. To progress the challenge, the sudden obstacle is a soft mat. The patient must not only clear the obstacle immediately, but also instantly adjust to an unstable landing surface, heavily challenging their dynamic ankle stability.
This is a demonstration video of doing a balance exercise. This exercise is called as rocker board perturbation exercise. This exercise is designed to improve balance, control, postural reactions, and reduce fall risk, especially in older adults. This works by challenging the body's ability to respond when balance is suddenly disturbed. Firstly, a good demonstration is needed to ensure a better understanding on how this exercise works. Then, have them try it out by themselves and monitor their safety. Guide them, be close, or hold on to them. Add a minimal perturbation such as tapping to them to make their body react with the sudden force. After a while, start the exercise with a frequency of 20 to 30 seconds with 2 to 3 reps depending on their safety. Progression can also be added to make the exercise harder. Small ball can be used as a quick distraction. Ask them to catch the ball while maintaining the position on the rocker board. Now, let's continue with another exercise. This exercise is called as soft ball tapping with soft ball swap. This exercise helps to improve multi-directional stepping reactions, give stabilization and dynamic balance recovery during an unpredictable test. 2 small balls are needed to complete the exercise. As usual, a demonstration is needed for a better understanding. Now, let's proceed the exercise by asking them to constantly tapping the ball using both hands. Make a sudden move by throwing a different ball and make sure the tapping is still going. The exercise can be done with a frequency of 1 to 2 minutes with 3 repetitions, also depending on their safety. Progression can also be aided by changing the size or weight of the ball. Different speed, different difficulties. Both exercises can go to an easy approach by doing the exercise in between the parallel bar or wearing gait belt to enjoy comfort and safety.
Lean forward into my hands keeping your body straight like a plank without bending at your hips. When I take my hands away, quickly take 1 step forward with either foot to catch yourself and regain your balance. Repeat 5 to 8 successful step recoveries. Progression: increase the lean angle slightly before release or instruct participants to step forward using specific leg only. Stand with your feet shoulder width. I am going to give you a gentle tap on either your left or right shoulder. When you feel the tap, quickly take a step out to that side to steady yourself. Then step back to the middle. Do 10 repetitions, total 5 taps per side, randomized. Progression. Performs the exercise while touch or kick the ball. This exercise is called tandem standing with ball catching. All you need for this exercise is a ball. To start, you need to stand in heel-to-toe position and prepare your hand to catch the ball. There will be therapists beside you as a precaution. What you need to do is maintain your balance while catching and returning the ball. Next is reactive reaching exercise. You need to stand upright in front of the object and hear for the therapist's instruction. Therapist will ask you to pick the object from the table and putting it back according to therapist's instruction. Therapist will also change the direction for you to pick up the object to increase the difficulty.
The obstacle pause audio cue stop and think. This exercise brings rapid gait terminations and rapid change of direction in response to sudden environmental auditory cues, simulating avoiding a hazard while walking. It targets balance components such as gait adaptability, dynamic balance, and stepping strategy. For progressions, we can narrow the walking path by placing the cone closer together or ask the patient to carry a tray with a plastic cup of water while walking. Multi-directional stepping with stop and go visual cues. The aim of the exercise is to coordinate rapid reactive stepping in multiple planes using real-time visual spatial processing. It targets dynamic balance, reactive balance, and stepping strategies. Progressions, the therapist can introduce conflicting cues such as step on red when I say blue to increase the cognitive processing demand and delay pre-planning.
To wrap up, reactive balance and perturbation training are incredibly important for helping older adults maintain functional independence, build movement, confidence, and drastically reduce the risk of falls in daily life. Most importantly, older adults with a known high risk of falling should always perform these movements under the direct supervision of a trained healthcare professional or physiotherapist. Thank you for watching, stay safe, and keep moving.